So welcome to our Narcan seminar, Opioid Overdose seminar. We're really happy to present this because we not only have our illustrious Director of Medical Operations, Tim, and he'll give his background, but also partnered with the Fountain Hills Medical Center and the Fountain Hills Fire Department, as well as this is really a partnership that really started with the Fountain Hills Chamber and us as chamber members, and then going to the Fountain Hills Coalition. I'd like to thank Mike Charnow for being here, Councilman Charnow. He's the director of the Drug Coalition. So we started working together on presenting not only from a clinical perspective, but also from an experiential perspective. Dr. Zimmy, do you have anything to say with regards to the partnership and all of that?
No, I mean, it's very exciting to be here because I think this is really exciting. Just to set it and having a forum like this where everybody's going to learn. Thanks to both of you for your service, for you to circle through all the being out in law enforcement and then coming in to do this. So we're excited about this. I'm happy to be here, and when the opportunity comes, I'll talk some more.
Awesome. Thanks, Dr. Zimmer.
Absolutely.
Councilman Charnow, do you have anything to say?
Yeah, no, I'm as well, and this is all about community and collaboration. So the more people we can get together and educate everybody on some of these issues, the better the community is, and I think we can make a real difference here in Fountain Hills.
That's a goal. Hopefully, this is the first one of many that we will be doing for this. We're Tim and I are going to be discussing how many per year. I think at a minimum maybe 2. Maybe 4, who knows?
Whatever the needs are.
Yeah, whatever the needs are. So this is going to be first of many, hopefully, that we're going to be doing and going from there. So if you guys have any questions, please don't hesitate to ask them. There are no students.
Where I come from with a lot of this training is looking at who needs the training, whether I'm teaching people at the hospital, whether I'm teaching firefighter, paramedics, EMTs on the street, whether I'm teaching law enforcement, or whether I'm teaching civilians. So I think it's really terrific that we're looking at this as it takes a village to save lives. Whether it's an overdose emergency, whether it's a bleeding control emergency, whether it's a CPR or cardiac arrest emergency, it does take all levels of participation. And believe it or not, it doesn't start with the fire department or the police department showing up. It starts with the immediate responders, the people that are seated here getting bit by the gnats and everything else. It starts with you guys and gals recognizing emergencies, calling 911, and taking steps prior to law enforcement, fire, and EMS arriving. So if you have other questions as we go through, let's just stop and chat about things. But if it were only this easy, right? Yep, those are drugs. The ones on the left, those are probably prescription. All right, those are okay. I call those medications because usually a doctor writes the prescription for them and I fill them at a regular pharmacy. Synthetic opioids. Right now, this is what we're talking about. Heroin is over here. Okay, we have maybe 50 grains of fentanyl here, and then carfentanil, we have about 3 to 5 grains right there. So that just kind of gives you, these are all the same potency. Because I want you guys to understand some of the good information out there about working around fentanyl. There is a lot of misinformation that goes around, and you'll find videos on YouTube, you'll find public service announcements from law enforcement agencies that put things kind of out of perspective. And we'll talk about to protect yourself from an exposure. Excellent. So, wear gloves in the presence of fentanyl or when you suspect it's fentanyl. Really, we should be wearing gloves a lot anyways. Avoid actions that may cause it to become airborne, so don't go clapping your hands, even if you're happy and you know it. Using an appropriate respirator and eye protection may minimize some skin contact. Most of us are wearing masks, or some of us are wearing masks when we go inside closed buildings, but it'll minimize the amount that you could inhale. And then this is talking about follow department guidelines if you encounter large amounts of fentanyl and how you should try and handle that. When an exposure does occur, okay, we want you to minimize contamination and notify first responders. Don't touch your eyes, nose, or mouth, or any other skin after potentially touching a contaminated surface. Wash your skin with cold water and soap, but it's important not to rely on your hand sanitizer. I call it Magic Cut Finder because I always find those fresh cuts, but this is another reason because it opens up your pores. So the reason why we don't want to use alcohol-based hand sanitizers is it opens up your pores to absorb that fentanyl or that suspected medication even more. So go back to your soap and water. Wash your hands thoroughly before eating, drinking, smoking, or using the restroom. And if you get it on your clothes, take your clothing off. Chronic users are actually at a high risk for opioid overdose after they've been released from detox or from jail, because they're like, hey, yeah, I'm out. Let's go party with my friend. Oh, here I am again, overdosing. This sucks. Other people who are at risk include the chronic illnesses. Thinking about people who might be living with cancer or end-stage cancer, they might be at risk for an opioid overdose because it does hurt. But this also does not discriminate against any age or socioeconomic demographic. So, is it this easy to spot an addict? Okay, I mean, granted, mug shots are kind of a giveaway, and here's like that, but no, I don't think it is. Not in my experience. These are the people who are overdosing on opioids right now. Guys, remember this gentleman? He was taking fentanyl, overdosed, along with alcohol. This is Corey Monteith from Glee, very successful, very popular. Don't know how he got hooked, really doesn't matter. Granted, Prince did a couple of other things, but Heath Ledger, Anna Nicole Smith, and then just even these kids getting into medications that are not secured within households. So it is important to lock up your drugs and lock up your guns so that kids don't get a hold of them. Hot off the presses, the gentleman from, Michael K. Williams. He was in several successful shows. They came back and said that he overdosed on fentanyl, or gal. So, because it's not always easy to spot somebody who is an addict, you might notice some social signs of abuse or misuse, an increase of drowsiness or lack of energy, increased isolation, increased problems in school or at work. Increased secrecy, like they're hiding their phones, they're deleting their browser history all the time. Irritability and mood swings. Agitation and restlessness in the morning because they're trying to get up to that, quote, therapeutic level of their opioid dependency. And then problems with self-control, outbursts, yelling, screaming, throwing things when that wasn't them in the past. You might notice a decrease in self-esteem, decrease in their concentration and their motivation, some hopelessness, decreased dependability, and lack of interest in their own personal hygiene. So these just might be some things that you can use to help you spot an addict if they're in your life, one way or the other. So it's super safe, okay? Naloxone is super safe. It blocks only the effects of opioids. So if you are on blood pressure medication, if you are on blood sugar medication, if you are on blood thinning medication, if you are on blood cholesterol, if you are on birth control, if you are on antibiotics, it won't impact those medications. It won't react with them at all. It only works if there are opioids, and it only works in the brain to help the victim start breathing temporarily, because some of the medications or drugs that people are taking last for several hours. While the effect of Narcan is pre-measured, so that we don't have to worry about getting the right amount. And as I mentioned, you can give them 4 milligrams. That's a lot. Normally when I give them IV doses, it's 0.4, 1/10 the dose. But it's designed for self or peer administration of the medication. It's very easy. So this is what it kind of looks like. Most of the time the person is going to be laying flat on their back because nobody's standing, walking around having a true overdose, okay? They might be high, which is okay, but when they lay down, and again, we go back to our ice cream, and here comes our froyo, and it says, get out of here, ice cream. So they put the tip of the device just inside the nose, and these are the little atomized particles catching the turbinates and all of the vasculature in the nose. So these are what the packages look like. Step 1, open the package. Step 2, grab one of the inserts and remove the foil backing. Insert it just inside the tip of their nose, and then there's a plunger which you depress all the way. So here's that little plunger. This goes just inside the tip of their nose. This is not like exploring their brain cavity, sticking it all the way in. This is not like a 6-year-old trying to find the bead in the back of their nose. But when you press that plunger, you have this misting, this aerosolization of the Narcan. This is the auto-injector. We have some training devices here, but This route of administration is not as common here in Arizona, but beware. This is if you have somebody who is has an anaphylactic reaction to some sort of allergen, and they have an EpiPen. This is the same concept. It's going to be the outside of their thigh. It's going to be the front portion of their shoulder, and you're going to press and hold when you administer this. Again, there's a needle involved. You're going to keep holding for about 5 seconds after you hear the click and the hiss, and then the needle should retract back in, and it won't be visible, but I'm not dumb enough to stick my thumb over that open end. So here's what we're talking about. Through their clothing, okay? After you remove the safety cap, you go right through their clothing. This is not an excuse to take people's pants off.
That's the stop the bleed class.
So you see that, and the analogy that I use is depending upon where their hand comes in contact with, like the 45-degree angle, not the side of their thigh, not the front of their thigh, but that 45 right down the middle is about where I'm going to give it. So just past where their pockets end. So you'll press and hold. It cannot be reused. Put it back in the outer case. Don't attempt to replace the safety guard because there's a dirty needle in there now. And then it gets given to fire EMS or to law enforcement, and it gets disposed of. So let's summarize before we get into some training scenarios and review our pop quiz. First of all, naloxone is safe and effective in treating opioid overdoses. If you think they're overdosing because they're unresponsive, they're blue, they've got pinpoint pupils, you suspect it, give it to them. All right? Don't hesitate. Give it to them. It may lessen the lethality of opioid overdoses by getting Narcan on scene faster than law enforcement because you are now an immediate responder. Make sure that you are activating your emergency response system or 911, or if you're at your workplace, if you have a different emergency activation plan or EAP, make sure you do that. And I really want you to consider providing CPR or chest compressions because they better not really be breathing, which is why we're giving them the Narcan or the Naloxone. All right, let's review our pretest, our pop quiz. It's easy to spot someone who's addicted to painkillers. I think everybody agreed that was false. The use and abuse of painkillers is most common. Nope, that's false. It was actually people 45 to 54. Narcan has no negative side effects and is safe in every situation. Well, if they're overdosing, it's safe. If they're high, it's not safe to give that to them because of the opioid withdrawal syndrome. The opioid epidemic situation is getting better in Arizona, and none of my graphics supported that. It's getting worse. I only have to dial 911 and give Narcan to someone who I think is overdosing. I should probably be pushing on their chest, or at least putting them in the recovery position, and maybe finding an AED if I'm pushing on their chest. It's before we gave the second dose of Narcan, but we could pretend like the AED showed up, and the AED we would turn on and put it through its paces. So let me save these real quick. Still 100 for 100, okay? 100% adequate depth, 100% adequate recoil, but they were going at 138 times a minute. I think I actually know who that is, and I won't single them out. 138 is a little bit fast because you want to allow the heart a chance to recoil, so when you squeeze it the next time, it's mostly full. And going at 138 times a minute, you're going to wear out, and the heart's going to be half empty most of the time. So if you thought a minute was long and was a little bit taxing, 2 minutes gets a little bit better when we give you some pointers and some tips and tricks on how to use your body mechanics instead of your muscles to do the CPR. But we'll be able to answer your questions, and you can check out some of the stuff that Guardian has over here.
Thanks so much. You're no longer the